Thank you for the introduction. I am from Rehabilitation Department of Konkuk University Hospital. I am Kyeong, and I'll be talking about exercises for breast cancer survivors. The effectiveness of exercise from different surveys have been analyzed. Exercise helps strengthening muscles, increasing the aerobic capacity, increase the quality of life, ease body fat, and reduce the depression and anxiety. And the recurrence and mortalities are also reduced. Let me go into more details for each factor. For muscle strength, this is meta-analysis graph at the very bottom, the diamond shape. If it's apart from 0, it means significantly important. And if it is at the 0, that means the effectiveness is not clear. For muscle strength, the hand grip strength and lower extremity, for hand grip, a significant difference and improvement was made. The aerobic capacity is improved. In multiple studies for breast cancer survivors, there was analysis, and with exercise, aerobic capacity increases. This is also for cardiovascular capacity. For example, you could prolong your exercise, and with stronger cardiovascular capacities, it is related to the reduction of other potential causes for death. The quality of life improves, the fatigue improves. In case of fatigue, we used survey for the assessment. And at each level of fatigue, there was a significant improvement in fatigue in multiple surveys. For anxiety and depression, there is a proven impact. Body fat is reduced after exercise, and as you heard from the previous presentation, BMI is improved. Although it's not written here, it was a study about muscle weight. With exercise, whether there is an increase in muscle weight, in some studies, yes. In some studies, not significant difference. So body fat reduction is clear, but increase of muscle weight, there are different interpretations. Next, reduction in recurrence. With exercise, compared to non-exercise group, the occurrence reduced by 21 to 55%. To reduce occurrence, minimum 3 to 5 hours a week walking is required, or meet an high level of exercise of longer than 2.5 hours every week. Next, mortality. There was reduction in mortality by 24.67%. This is not only for the breast cancer death, but also for all of the death cases. Next, what is required exercise for breast cancer survivors? Aerobic capacity, weight training, and flexibility training, they're all required. For aerobic exercise, minimum 150 minutes of mid-level exercise, or minimum 75 minutes of high-level exercise. For mid-level exercise, 2.5 to 5 hours. For high strength, 75 minutes to 2.5 hours. You can mix and match these two different levels of exercise. You could break down the exercise routine, but you have to maintain exercise at least 10 minutes at each time. This is intermediate level example. The intermediate level includes the maximum heartbeat level, 50 to 70% of maximum heartbeat. That is in intermediate level. And maximum heartbeat there is a set amount for each age. 220 minus your age is the maximum heartbeat. For example, if you are 50 years old, maximum heartbeat would be 170. And intermediate level exercise would refer to exercise with heartbeat between 85 to 120, but you cannot really check continuously this heartbeat. So the examples would be you have a little bit of short breath, but you could still talk to people. It includes aquarobic swimming, golfing, and badminton, tennis, and cycling at a normal speed. For high-level aerobic exercise, 70 to 85% of a maximum heartbeat. So if you're 50 years old, the heartbeat of 100 and 145 would fall into this category. And when you are engaged in this exercise, you experience short breath, and it's difficult to talk to the person next to you. This includes running, rope skipping, and cycling at a fast speed. Weight training is also important, 2 to 3 times a week using large muscles, and 2 to 3 sets, and 8 to 12 times per set. Start from lower strength and gradually increase the weight. And after taking a break, you have to go back to 2 weeks prior to the to the time when you stopped exercising. For breast cancer survivors, you don't need to limit the weight. Instead, there could be lymphedema or pain in the shoulder or pain. And during weight training, if there is a lymphedema and if you feel pains, you have to reduce the strength. Weight training and muscle exercise includes elastic band and weights and utilization of other machines. These are examples of the movement. This is for a muscle strength on the upper body. You could bend and stretch your elbow to strengthen the upper and upper side of the arm and the side of the arm and the back of the upper arm. And for shoulder muscle strength, you could lift the weight and when you are working on the shoulders, your arm must be elevated to the level of shoulder or slightly higher than shoulder. And this is chest exercise. When you're lying down, you push the weight toward your front. And then chest fly is another movement. For abdominal strength, exercise must be included. This is flank to your left. So your body must be straightened, and your body weight is bared on 2 arms and 2 feet. And to your right, this is part of Pilates. This is called Pilates 100. When you lie down, you lift your shoulder and legs and pumping your arms and count until 100. Sit up and roll up are also for abdominal muscle strength. So when you are sitting up and laying down, you have to consider your movement of the spine. And this is for back strength. Bird dog to your left and to the right. You face the floor and your both arms and legs must be up in the air as if you are swimming. This is strengthening your spine. And this is for hip muscle. So you lie down and then you lift your hip to make sure your shoulder and hip in a straight line. And to your right, this is a single leg bridge. These two movements are all for strengthening hip muscle. Squat and wide squat. Squat is strengthening the hip and thigh. For wide squat, hip and inner thigh muscles. Lunge and side lunge. In case of lunge, this is for front and back of thigh, and for side lunge, hip and inner thigh muscle strength. This is using elastic band. You stand straight and then you kick backward with elastic band to strengthen hip muscle. And you lie down on your side and use elastic band to strengthen muscles in inner thigh and hip. From this side flank, you kick front or you kick backward to strengthen muscles in hip and thigh. And this is for calf. You lift your heels and you repeat this movement. Also do this in wide squat to strengthen muscles in calves. So this was the introduction of muscle strengthening. The patient does not have to complete all of the postures. You could pick and choose 10 to 12 and try to complete 2 to 3 sets each. Next, flexibility. You can do this along with muscle exercise and aerobic exercise. This is a stretch of tendon and large muscle. And please maintain each posture for 10 to 20 seconds. And when there's a stiffness, when you feel the stiffness and a slight pain, then that's the right threshold. If you feel pains too strongly, then you should stop there. And this is for neck stretching, and this is shoulder stretching. You cross your arms, you pull them toward your torso, or you push down your upper torso and you stand next to the wall, and with putting your one hand, you can try to do the stretch. And this is for abdominal stretch, and this is for side stretch, and this the right side one is for stretching abdominal and back. And if you pull your leg with number 4 like posture, the hip is stretched, and this is for pelvic front side of pelvic stretch. And to the right, this is stretching the outer side of thigh. And from yoga, you push down your knees to the floor, stretching thighs, and you pull your legs toward your head. And then while standing still, you can also stretch the front side of your thigh. This is the last stretching posture. You stand against the wall and try to push the wall to stretch the backside of the calf. Just like other cancer survivors, for breast cancer survivors, all of 3 exercises are required. And the most important focus is that it's important to continue to exercise, but you have to make sure that your day becomes very active instead of lying down or sitting all the time. So far, I talked about general information about exercise. We may have patients right after the surgery. So how long should they wait until they start exercising? Immediately after the surgery, there would be a drainage tube. And if the exercise is too strong, there is an increase of serosomas. So you must start exercising after getting rid of drainage tube. After 7 days, try to lift your arms within the range of 45 to 90 degrees. After a week, you could gradually expand the range of movement. This is for the upper body. You start from abdominal breathing, and this is how you do the shoulder and arm exercise. With your elbow bended, try to pull both sides of your shoulders together. And then this is the lifting of your arms to upward. And then using your fingers, you could safely and gradually extend the operational range of shoulder after surgery. And the plastic surgeon talked about breast reconstruction. Those patients with reconstruction, you have to be careful in exercise. Depending on the method and the stage, more detailed recommendation is required. So there are implant reconstruction and autologous in reconstruction. In both cases, try not to lift your arms higher than your shoulder, but washing your face, combing hairs, and having meals, you can do that within 2 weeks of surgery. For the first 2 weeks, try not to lift up your arms above your shoulder. Do not lift heavy object, and pushing and pulling heavy doors, and getting up from the bed from the side of surgery are not recommended. After 2 weeks, these are recommended exercises. Rotating torso and lifting up your shoulders. And after 3-4 weeks, lying down, you could stretch your arms 180 degrees. And then you could stand next to a table, and then you could do these exercises. After 6 weeks, most of routine activities and movements are possible. But even after 6 weeks, try not to lift heavy objects. Aerobic exercise can start from here. And even if you have normal operational range of shoulder joint, you have to continue stretching to make sure it doesn't get stiff again. After autologous reconstruction, after 2 weeks, the same series of exercise recommended: circulation of the shoulder joint and lifting up your shoulders and down. And after 3 weeks, again, the similar series of exercises, as you can see from the pictures. After 4 weeks lying down, you could put your both arms together and try to point the sky. And then rotating your shoulder joints, and with breathing, you could put together your both arms as if you were hugging a tree stem. After 4 to 6 weeks, arm and shoulder operational movement range can be extended. In most orientation, it would recover to the normal level, but the recovery speed vary by each patient. Again, try not to lift any heavy object with the arm on the surgery side. 6 to 8 weeks, you could increase the exercise, and the goal would be recovering the normal range. After 12 weeks, all of the activities are possible. If you go back to the exercise that you did before surgery, start from low strength. So far, I talked about recommended exercises. When patients are exercising, they're concerned about lymphedema. In the past, for patients with surgery, we ask them not to do the weightlifting and try not to lift heavy object for a long time and not to use the arm on the surgery side because of the concern of lymphedema. Then the weight lifting using upper extremity would worsen lymphedema. So this is the supporting information. In a recent survey using this weight, the upper extremity weight, tricep exercises are implemented. High strength and intermediate strength and control group. The volume and other indexes in the arm does not show any differences. So having weight training does not worsen lymphedema in case of arms. And for surgery patients, we did shoulder stretching and we use elastic band. And this study also shows that no significant difference between exercise group and control group. So in conclusion, with weight training, there is no worsening of lymphedema. So the weight training and weight muscle exercise is safe for breast cancer survivors. But if there is a high-risk patient with existing lymphedema, it would be better for them to wear compression stockings. Now, muscle exercise, would it prevent lymphedema? According to one study using light weight and elastic band, with gradual increase in the strength, and then the result was compared to control group. The exercise group and control group, the swelling, tension, heaviness, and volume before and after exercise, not a big difference. So from this study, muscle exercise does not necessarily prevent lymphedema, but just like the previous survey, it doesn't mean that muscle exercise would worsen the lymphedema. So the conclusion is same from these two studies. So for breast cancer survivors, these exercises are required. For aerobic exercise, 150 minutes at the minimum 150 minute intermediate level and minimum 75 minutes of high strength activities. For muscle exercise, 2 to 3 times a week with large muscles, 2 to 3 sets, and 8 to 12 times each set. For flexibility, do it along with aerobic exercise and muscle exercise. Again, after surgery, customized exercise would be required based upon the type of surgery and how long it has been. This is all I prepared for today, and thank you for your attention.